Let's look at some more morphology of the knee. And we mentioned the Q angle previously. And I do want to preface this by saying the Q angle, there's a lot of debate about the Q angle, especially the static Q angle being associated with any sort of injury. It's kind of been handed down through the literature. People are doing more research on the dynamic Q angle. So when we're moving. So this is just a definition of what this Q angle is, but just note it is not definitive that it's associated with an increase in injury in women, because on average, women may have larger Q angles due to wider pelvis. So the Q angle is made by the line of action of the quadricep muscle group relative to the line of action of the patella tendon. So this little angle right here is the Q angle. Typically 15 degrees or less for males and 20 degrees or less for females. Another movement or posture morphology for the knee joint is frontal plane knee alignment. So again, this is postural static alignment, and it's the angle between the long axis of the femur and the long axis of the tibia. So you get genuvalgum or knock-kneed or valgus knee when the line of your femur and the line of your tibia looks like it is going into abduction. For valgus, you have an increased compression on the lateral side of the joint and an increased tension on the medial side. For genuvarum or varus or bow-legged, again, it's the line of the femur relative to the line of the tibia, so it looks like it's moving in or into adduction. You're going to have an increased compression on the medial side of the knee and an increased tension on the lateral side. Looking at dynamic or movements, forces that will push you into valgus or varus. If you have a valgus force, so it's coming on the lateral side, you'll have an increased tensile load, potentially rupturing the medial collateral ligament and increased compression on the lateral side. If you have a varus producing force coming from the medial side, you'll have an increased tension on the lateral collateral ligament, potentially rupturing it, and increased compression on the medial side. And then we have something called the terrible triad, which is rotation, valgus, and extension on a planted foot that basically injures the ACL, the MCL, and the medial meniscus.